Hemoglobin, the protein that transports oxygen throughout the body, is impacted by a group of hereditary red blood cell abnormalities known as sickle cell disease. 20 million people globally and more than 100,000 Americans are affected by the illness. To better understand sickle cell anemia, we need to understand what sickle cells are. Red blood cells typically have a disc shape and are flexible enough to pass easily through blood vessels. If you have sickle cell disease, your red blood cells are crescent or sickle-shaped. These cells might obstruct blood flow to the rest of your body since they are stiff and difficult to move. Stroke, eye problems, infections, and painful episodes known as pain crises are just a few of the significant issues that can result from obstructed blood flow throughout the body. Now, let's have a look at the symptoms of sickle cell anemia. They are born with sickle cell disease because it is an inherited condition. However, until they are about 5 or 6 months old, the majority of children do not experience any symptoms of the illness. The signs and symptoms of sickle cell disease can differ from person to person and change over time. Your specific symptoms will depend on how the disease affects your body over time. Early symptoms: a yellowish color of the skin that is jaundice or whites of the eyes or icterus occurs when a large number of red cells undergo hemolysis. Extreme tiredness or fussiness from anemia, and painful swelling of the hands and feet, known as dactylitis. The symptoms which require emergency medical assistance include: severe anemia symptoms include excessive exhaustion, shortness of breath, lightheadedness, or an irregular heartbeat. Severe anemia symptoms can be brought on by an aplastic crisis or a splenic sequestration crisis. These ailments may pose a serious risk to life. Any child or adult with sickle cell disease who develops a fever of more than 101.3 degrees Fahrenheit must be evaluated by a doctor immediately and treated with antibiotics. Hospitalization will be necessary for some people. Acute chest syndrome symptoms include shortness of breath, fever, coughing, and chest pain. You must be admitted to the hospital, where you might need oxygen therapy, antibiotics, or a blood transfusion. Symptoms of a stroke include abrupt weakness, numbness on one side of the body, and confusion. People with sickle cell disease may present in emergency room with any of the symptoms above, and should be treated immediately. Let's have a look at pathophysiology of sickle cell anemia and genetics involved. In brief, sickle cell anemia is an inherited disorder that leads to the production of an abnormal type of hemoglobin called hemoglobin S, or HbS. Sickle cell tests determine the presence and relative amount of hemoglobin S in a blood sample or detect mutations in the genes that produce hemoglobin to help diagnose sickle cell anemia and to identify people with sickle cell trait. An individual with sickle cell disease and anemia inherits 2 defective gene copies, one of which is a HbS gene. A person with sickle cell anemia, the most prevalent and dangerous form of sickle cell disease, has 2 copies of the HbS gene. One who receives 1 copy of the normal hemoglobin gene from one parent and 1 copy of the HbS gene from the other parent is said to have sickle cell trait and to be a sickle cell carrier. Typically, carriers don't show symptoms of sickle cell illness but can still transmit the mutation to their children. HbS can form crystals that change the shape of the RBC from a round disc to a characteristic sickle shape. This altered shape limits the RBC's ability to flow smoothly throughout the blood vessels in the body, limits the hemoglobin's ability to transport oxygen to tissues, and decreases RBC lifespan from 120 days to about 10 to 20 days. A person with sickle cell disease, homozygous for HbS, can become severely anemic because the body cannot produce RBCs as fast as they are destroyed. The affected person can suffer painful episodes and a variety of complications when sickled cells become lodged in and obstruct small blood vessels. If someone has sickle cell trait, they are a carrier of the hemoglobin S gene. That means they can pass it on when they have a child. If the child's other parent also has sickle cell trait or another faulty hemoglobin gene, such as beta thalassemia, hemoglobin C, hemoglobin D, or hemoglobin E, that child has a chance of having sickle cell disease. That is because the child could inherit a faulty hemoglobin gene from each parent. Now, let's have a look at few treatment options available to treat sickle cell disease. After early diagnosis, your healthcare provider may recommend medicines or transfusions to manage complications, including chronic pain. First, medicine to prevent the sickling of red blood cells. Voxelotor treats sickle cell disease in adults and children 4 years old and older. The oral medicine prevents red blood cells from forming the sickle shape and binding together. This may reduce the destruction of some red blood cells, which in turn lowers the risk for anemia and improves blood flow to your organs. Next, medicine to reduce vaso-occlusive and pain crises. Crizanlizumab is approved for adults and children 16 years old and older who have sickle cell disease. The medicine, which is given through an intravenous line in the vein, helps prevent blood cells from sticking to blood vessel walls and causing blood flow blockage, inflammation, and pain crises. Hydroxyurea is an oral medicine that has been shown to reduce or prevent several complications of sickle cell disease. Next, medicine to treat pain. The FDA approved L-glutamine for people age 5 and older to lower the number of pain crises. Research showed that patients taking L-glutamine had fewer hospital admissions than patients taking a placebo. The medicine is prescribed as a powder that is mixed into liquids or foods like applesauce or cereal. Lastly, a blood and bone marrow transplant is currently the only cure for sickle cell disease, but it is not for everyone. Many patients who have sickle cell disease do not have a relative who is a close enough genetic match to be a donor. A well-matched donor is needed for a patient to have the best chance for a successful transplant. Thanks for watching. Please subscribe and support us to learn more. Thank you.